So after getting a tick bite, if suppose I know I got it, so what is suggest to do the next immediate steps?
Okay. The tick bite, the tick. Do you have to remove it, and you have to remove. You should not use any alcohol or to burn the tick. You have to press gently the tick and to exert a pressure upward with a tweezer to remove the tick. Now, once you have the tick, what do? Or the CDC tells you don't send it to be identified. Why? Because even if the tick is infected, it's not sure that infect the person. This is what the CDC said. Some other will say it's better to know that not to know. So if the tick carries Babesia or Anaplasma, there is more chance for you to have that, and we may target a better prevention. So saying that, there are three attitudes in face of a tick bite. The first recommendation is from the CDC. The CDC tells you that if you find a tick that was attached for more than 36 hours on your skin and you are still within 72 hours of the tick bite, take a single dose of doxycycline, but a double dose, 200 milligrams of doxycycline, and that's it. And you will not have Lyme. Great. This is the CDC 101. This is what the health department tells you, what infectious disease tells you. This is the national recommendation. The second attitude that we see, which is the most widespread attitude, and that is what I hear, is that the doctors will say, wait and see. If you have symptoms, treat. If you don't have symptoms, forget it. Mm-hmm. The second recommendation is ILADS, and I guess you know that I'm an ILADS member, so I will, of course, follow the ILADS guidelines, is to give not less than 1 month of doxycycline. So there is a big problem here, because you don't treat, you prevent a disease with 1 month of antibiotic, and you tell me that the treatment of Lyme is 3 weeks of doxycycline. It's not possible. What's going on? So we have to review the three recommendations. The first recommendation is what all your auditors will hear from their doctors, a single dose of doxycycline. But you have to know where it comes from. It comes from a study in 2001 published in a New England Journal of Medicine by Dr. Needleman, who took people who had a tick bite and they looked for 6 weeks. They followed these people for 6 weeks. Did they ask them, are you tired? Are you depressed? Do you have joint pain? Do you have depression? Do you have back pain? No. Do you have a bald ass rash? Since the most reliable for them sign of Lyme to say it's Lyme, because back pain, you don't know if it's Lyme. So they chose purposely to use a reliable marker of the disease, bald ass rash. So they give you 200 milligrams of doxycycline on the first day, and they ask you to come, and after 6 weeks, you are discharged from the study. So this study tells you that 200 milligrams of doxycycline guarantees only one thing: you will not have a bald ass rash, like 90% of people who have Lyme, or maybe less. But and second thing, what happened after 6 weeks? Nobody knows. So Alan Steer, the doctor who discovered Lyme disease in Connecticut in the town of Lyme, writes that Lyme disease, neurological problems of Lyme may occur 14 years after a tick bite.
Oh my God.
So if you want to wait and see symptoms, like the doctor says, you have to say, do I have to wait 14 years to know if I become schizophrenic or not? So yeah. So you don't know. So 6 weeks is not enough to guarantee anything. Also, they did not look for fatigue, headaches, pain, only bald ass rash. So this is the limitation of this study. The second attitude to wait and see is, I don't know, is a doctor who made up that one in his office and people copy him. This has no ground, scientific ground. There is no studies that support such an attitude that allows a disease from to happen. It's not preventive. The third recommendation is eyelash. So one, why? Because the sooner you treat, the better it is, the better outcome it is, because the bug is not yet disseminated everywhere. So you have a better chance to eradicate Lyme. The thing is that if you tell me, if I have a tick bite, what is the chance for me to be sick? I tell you, how many people in America had a tick bite last year? Impossible to know. Impossible to know. How can you make a ratio if you don't have the top number? Many people do not know they had a tick bite. It maybe it's the scalp, maybe in the back, maybe it's just a dot. So it's impossible to know. So when you want to get an antibiotic for a sore throat, you want to have a throat culture. You want to know if you have a strep or not. And here you want to take antibiotic for 1 month. You need to know if you have Lyme or not. If you be sick, but tough luck. We tell you, sorry. I cannot tell you what is your chance to be sick. So now, if I know because my tick carries Babesia or Lyme, what is the chance for me to be infected? CDC tells you maybe you will not be infected. We know it's not sure. It's likely, but it's not 100%. Now, if I have the bacteria in me, what is the chance for me to be sick? What do you mean by sick? A headache over 1 week or to be crippled for 35 years on a wheelchair? I don't know. So there is not I don't know. What we know is that the CDC admits that 10% of people who have Lyme will not be cured. Will not be cured. We disagree with 10%. Many people are misdiagnosed. Many people do not go to the doctors. And studies bring up to about 36% of people who had Lyme who will not be symptom free. So the CDC will tell you, maybe I don't want to digress too much, but the CDC will tell you is post-treatment Lyme disease syndrome. That say, yes, we admit that 10% of people will have joint pain, even encephalopathy for months, for years. And which treatment for that? The CDC writes on his website, unfortunately, there is not yet proven treatment. But I don't want to drag us too much. The problem is that eyelash knows how nasty Lyme can be. And I'm sure that you remember of HIV and in the 80s. You remember how many people died from AIDS? So if someone had the needle stick or had an encounter with someone with HIV, and you tell him, oh, it's not likely that you have, or you have some antibodies, but not a lot, it's not significant, but you have some antibodies, but not to qualify as positive, you don't need a treatment. You cannot accept that. You want 3 antibiotics for 1 month because you know how severe, how deadly, how devastating can be the disease. So when you know Lyme, you are scared of Lyme. And when you have a tick bite, you want the best prevention. It's not according to numbers, it's not according to statistic. If you want to take 1 month of antibiotic because you want to have a proof, I'm sorry, but I'm the wrong doctor. I can just testify of what I see, how life can be shattered, how people can be schizophrenic, bipolar, depressed, have pain for 30, 40 years because of a stupid tick bite. For that, I want the best. And I will follow the recommendation of eyelash to use at least doxycycline for 1 month.